All right, so what'd you guys get?
21.
21.
20.
21.
Okay, so for those that got 21, you actually got 20.8.
Yes.
Yes.
Okay, so if you got 20.5 or higher, okay, you can't give a partial drop. So if you got 20.5 or higher, it would be 21. If you got 20.4 or lower, then it would be 20. That's how you round. This one has to be rounded to the nearest whole number, and it even tells you that. Okay, so 21 was the answer you got, and you're correct. And there's your formula for those of you who aren't sure yet. There's your formula. Anybody have a question about that? Okay, now let's read the question. So the question says the nurse prepares how much medication to administer the correct dose. So this is a desired over have question, okay? And that's how you're going to set it up. So let's read the question. The healthcare provider's prescription reads to administer, can you guys see the question?
Mm-hmm.
To administer an IV dose of 400,000 units of penicillin. The label on the 10 ml amp from the pharmacy reads penicillin 300,000 units per ml. The nurse prepares how much medication to administer the correct dose. Now, I hear nurses say, oh, look at all this fluff they put in there to trick me. That's not what they did, okay? In real life, your patient's getting penicillin 2 or 3 times a day. So the pharmacy sent up a 10 ml ampule so that you can pull multiple doses out of that and give it to the patient, because that's how you're really going to get it on the floor. You have to be able to draw from that 10 ampoule to get the correct dose. Okay, so in order to do that, we're going to do desired over have. Oh, I'll get this screen shared stuff down right. Now it looks like a lot of numbers.
We see the whiteboard.
I know, I want you to. So the physician ordered 400,000 units. Okay, and you have 300,000 per ml. Okay, you see the question now? Or you still see the whiteboard?
The whiteboard.
Whiteboard.
We see your math.
Yeah.
Yeah, I see the whiteboard with the math.
See the question?
Now
See the question now.
Okay, now the question says the healthcare provider's prescription. That is always your desired dose. Your desired dose always goes on the top. So if you go back and look at the whiteboard, you see I put the 400,000 on the top. Right? What you have on hand is 300,000. So all you have to do is divide the 400,000 by the 300,000. So 400,000 divided by 300,000. And since it's only 1 ml, you multiply it times that. Now, for those of you that are math geniuses, you could cross out these zeros and just do 4 divided by 3, because you have the same amount of zeros, right? It's going to give you the same answer. So what'd you get? 4 divided by 3 times 1.
1.3.
3.
Okay.
Can you see the question? Can you guys see the question?
Yes.
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 Okay, 1.3, great job. See how easy that was? You have to just ask yourself, what is the question asking me? Don't let the other stuff in the question get you confused. Okay, another thing that I want to show you, and then we'll do some more. Can you see the whiteboard?
Yes.
So on your scale, right, you have grams, milligrams, micrograms. So you just want to be able to always see that scale in your mind, okay? If you're going to the right, you're going from a big number to a smaller one. So this 1 gram is equal to 1,000 of these, right?
Mm-hmm.
So you're going to multiply. When you're going that way, you're going to multiply. Okay, and when you're coming this way to the left, all right, you're going to divide. Now, you also can say to myself, if I'm going to grams towards micrograms, I know I'm going to the right. I can move my decimal place, my decimal point 3 places to the right. Okay. If I'm going to the left, I can move it 3 places to the left. And that also would give me my right answer. So if I was going from milligrams to grams and my decimal point is here, 1, 2, 3, it gives me 1 gram. Okay, so you could do it either way. If you can picture the scale and picture the arrows, it will help you do the math a little bit easier. Can you see the question now?
Yes. No, we see the whiteboard.
Whiteboard.
The whiteboard.
How about
Now we
now?
see the question.
No.
Okay. All right. So let's see if you can do this one. The healthcare provider's prescription reads potassium chloride 30 MEQ to be added to 1,000 ml normal saline and be administered over a 10-hour period. The label on the bottle reads 40 MEQs per 20 ml. The nurse prepares to administer how many mLs of potassium chloride to administer the correct dose. So first of all, what is your formula going to be here?
Desire over half.
Desired over have. Good, because it's asking you how to administer the correct dose. So what is your desired dose?
30.
30, right. And what do you have?
40.
40 per 20
40
ml.
per 20.
Good. Now, is this true? Is this how you're going to give potassium chloride? You bet, because you have to give it slow. You're going to put it in a rider because it's rough on the veins. You have to put it in a brown bottle. You can't give it IV push. If you give it too fast, your patient's going to have a cardiac arrhythmia. So that's why the question is worded this way, because the person that wrote the question knows all that about potassium. They're not trying to trick you. And again, if you cross out the zeros, you have 3 divided by 4 times 20. And what'd you get?
15.
15.
mLs.
All right, if you got 15, you're a rock star. And if you didn't, you'll get there. And again, here's your equation so that you can see it. Okay, healthcare provider's prescription reads clindamycin phosphate 0.3 grams in 50 mLs of normal saline to be administered IV over 30 minutes. The medication label reads clindamycin phosphate 900 milligrams in 6 mLs. The nurse prepares how many mLs of the medication to administer the correct dose. So what is your equation?
Desired over half.
Desired over have. Now, here's your issue. You have medication in milligrams. The order says grams, okay? You can't give grams if you have milligrams. So you have to convert that gram into milligrams to do the math, okay? Because you can't do grams divided into milligrams. You have to convert it. So you have 0.3 grams,
So it's 300 milligrams.
correct.
Kilograms.
So you're either multiplying it times 1,000, okay? Can you see my whiteboard?
Yes.
All right, or you move that decimal point 3 places, 1, 2, 3. And when you put the zeros there, then you got 300, right? So now you have 300 milligrams on, that's your desired dose, right? And what do you have on hand?
900 per 6 ml.
900.
900 per 6 ml. So 300 is your desired. 900 per 6 ml is what you have. 3 divided by 9, because you could cross these out, times 6. What'd you get?
2.
2.
1.9.
2 mLs.
So if you got 1.9, do your math again. Make sure you did it right. As I said, sometimes you hit the wrong thing on the calculator. And there's your calculation. Can you see
I
the
got
formula?
1.9. I got 1.9, but it rounded up to 2. So
It comes automatically out to a whole number of 2,
yeah.
Yeah.
not 1.9.
Yeah, it should come out to 2 because this is not one that you're rounding.
No.
So 300 divided by 900 times 6.
It will actually be 1.99. If you divide 300 by 9 and multiply by 6, it's going to be 1.99. But if you multiply 300 by 6 and divide by 9, it will be 2.
It's
Okay, so
300
for
divided
this
by
one-
900, not 9. 300 divided by 900 times 6. You get 2.
You'll get 1.99.
You get 2. I just did the math.
I got 1.99 too.
So
You gotta
Got two.
divide 300 by 900 first, and then that answer you time by 6.
Right.
Yeah.
So if
Yeah.
you divide 300 by 900, you're going to get 0.333 times 6 is going to give you 1.99. But if
No
you
matter
multiply
which way I
300
do it, whether I do 3
I
divided
get-
by 9 or 300 divided by 900 and multiply it times 6, I still get
I
2.
get 2.
I got
Yep.
2.
I
I
get
don't
2.
know how you
Yeah.
guys are getting 1.99. Maybe it's the way you have your calculator set. You should be using basic calculator mode because that's what you'll be using on the exam. Even when I do 3 divided by 9 times 6, I still get 2. Let me pull up my calculator.
Hey. I don't got time for your shenanigans. What do you want? I don't got time for your shenanigans. What you want?
So that's what I got. 3 divided by 9 times 6. I got 2. Are you rounding something up when you're doing the math?
Yeah.
I think you're right
Around it.
about it being a calculator though, because I did it on my phone and I get 2, but when I do it on my calculator, it still comes up 1.99.
Yeah, so if you have a scientific
same.
calculator and you have it set a certain way, that might be the issue.
Okay.
All right. Okay, here we have phenytoin, 0.2 grams, okay? Orally twice daily is our desired dose. And on hand, we have 100 milligrams. So how many capsules are we gonna give? So what's the first thing you gotta do?
Convert 0.2 grams to milligram.
Correct.
I think you're gonna give 2.
All right, so everybody got 2?
Yes.
Yeah.
I'm gonna get a calculator for
Anybody not understand any one of the ones that we did so far? Okay, anybody want to go over any more? All right, let's flip it up to the PowerPoint then. Anybody have any questions about the videos or anything on the PowerPoint before I start? So I'm gonna try to go through it and cover as much as I can. Whatever I don't cover tonight, I'll go over on Friday. And well, hopefully we'll get through some questions on this PowerPoint, and we'll get through some also on the questions, the other questions that I have for you. Huh? Give me 1 second, guys. I can't. It's okay. Yeah, let's give him one. Yes, sweetheart. Sorry, did I say the wrong thing? Oh, okay. All right. So, intro to nursing. Okay. So nursing, you know, is a profession that's focused on helping people, families, communities, and we try to help
Ms.
people.
Loesch, we still see the
We're still
math
seeing the
problem.
math.
Of course you do. How about now?
Yeah.
You see
Good
the
PowerPoint.
Okay, good. All right. So as you know, nursing itself is a profession that's focused on helping people, families, communities, and what we try to do is help them attain, recover, and maintain their optimal health and function from the time they're born until old age. So as the nurse, you know, when someone comes into the hospital, right away, we're already working on that discharge planning. And that discharge planning includes trying to get that person back to their original level of health. So if they came in and they had a stroke, we would want to get them back as close to we can as whatever their level of functioning was prior to that stroke, and try to maintain their level of independence as much as possible. All right, we act as a bridge between a vulnerable public and healthcare resources that can make the difference between life and death, health, disease, and disability, well-being, and discomfort. And a lot of times we are that bridge, because right now, you know, there's a huge disparity still between people that can attain certain types of healthcare versus others. Even though they've tried to nip it in the butt, they really haven't gotten completely there. They're still working on it. So part of the history of nursing talks about, you know, the different theories that occurred in the early civilizations. Right now, nursing, the way we know it, it's a blended art of science, technical skills, cognitive skills, all these things that we use together to be this role model, this counselor, this person that people depend on, this medicine giver, this knowledge base. We're all these things for people. And so this knowledge, that we have comes from science, and it helps us to provide the care. It helps us to use skills to make this nursing a form of art. And then we have these skills that we learn, these techniques of working like equipment, computers, doing dressing changings, putting catheterizations in, and all these things that we do to help people achieve a maximum health status and quality of life. Now, the early civilizations, they believed that illness had some sort of supernatural cause. For example, the theory of animism. So they thought that spirits brought the health, and evil spirits would bring things like sickness and death. The role of the nurse and the physician during this time was separate and distinct. So the physician was seen as this, hero, this medicine man, and the nurse was seen more as a mother type of figure. And then during the ancient Greek civilization, we have these temples that were built, and they became the main centers where people would go to seek care. So, you had these male assistants working there in the temples, and they would care for the sick. All right. And then sometimes in the home or in the community, we had some people who practiced as midwives, and they would go out and also take care of the sick. Then we have the early Christian period, where nursing starts to become a little more formal. We have a clear defined role, and these deaconesses started to make visits to the sick, okay, because it was defined by Christianity. So nursing started to develop a purpose, direction, and leadership skills. Then in the 16th century, we have a shift from that religious orientation, and we start working towards warfare, exploration, and expansion of knowledge. So eventually what happens is, as nursing continues to develop, okay, it goes through these different stages. Women aren't really in charge of it. Men are more in charge of it, the physicians and the hospitals. So nursing doesn't have this great reputation. It's still women that are from working in these long hours with poor pay and unfavorable conditions. And some of the women even are prisoners, okay, that they give these jobs to do to come and help the people. So social reforms start in the 19th and 20th century to change the role of nurses and women in general. And now nursing starts to develop towards the way that we know it because of Florence Nightingale. So it was really World War II that brought a lot of those changes about, because the soldiers were ordered to go off to war. And those soldiers that went off to war traditionally were men that were in the home that were working. So they were going out earning a living and then coming home at night. But now they dragged all these men off to fight in World War II. So what happened is the women ended up staying at home, and they started going out and working, and then education and knowledge base started to expand a little bit. Any questions about that? All right, so Nightingale, she started to challenge different prejudices against women. She elevated the status of all nurses, and she wrote the first training school for nurses. She wrote books about healthcare and nursing education. So, well, you got the answer to that question in advance. The nurses preparing a lecture on the history of nursing should include which international organization as the first for professional nurses? How many people read this? You
Well,
guys
just
might be
gave the
on mute.
answer.
Yeah, I gave you the answer, but that's okay. The International Council of Nurses. So I want you to know the answer, okay? The International Council of Nurses was the first international organization for professional nurses. All right, American Nurses Association, the National League for Nursing are U.S. nursing organizations, and Sigma Theta Tau is an international nursing honor society. So you'll see that associated with like a lot of universities and stuff like that. Which set of terms best describes nursing at the end of the Middle Ages? What do you guys think?
A.
A.
Okay, actually B. It started to develop purpose, direction, and leadership. Okay, during the Middle Ages, nursing began to have more clearly defined role, where members of the religious order gave nursing care. The nursing orders were founded, and nursing became a respected vocation. Although the Middle Ages ended up in chaos, nursing had developed purpose, direction, and leadership. All right, give me 1 second, guys. I just gotta, this is the only problem about me being a program chair and lecturing, because I got somebody sending me a question that I need to answer about a student. So during the 19th and 20th century, social reforms changed the roles of nurses and women in general. Okay, and then nursing as we know it began based on the beliefs of Florence Nightingale. She challenged these prejudices against women. She wrote the first training school for nurses and wrote books about healthcare and nursing education. So really she made a lot of different contributions. So these hospital schools, they started to become organized, and they actually started to control nursing, and it gave them less expensive staff to work at the hospital. The nurses became under the control of these male administrators and physicians. So during World War II, a lot of women started to get out of the home and work. They became more independent and more assertive. This led to an explosion in medicine and technology and started to broaden the role of nurses, and nursing actually began to grow as a professional discipline. So Florence Nightingale, what kind of contributions did she make? Helping identify personal needs of the patient and the role of nurse and how that is geared towards meeting those needs of the patient. Also helping establish nursing education, standards for hospital management, helping nursing to become respected as a profession and an occupation for women, recognizing components of nursing, health, and illness, and helping the nurses establish education. Also, believing that nursing is a separate and distinct medicine. She also helped people learn that nutrition is important to health. And we know this today. I mean, why you guys have to take nutritional class? Because it is so important to every aspect of health. It doesn't matter if it's mental health, psychiatry, you know, when you're dealing with peds, you deal with nutrition. When you deal with pregnancy, you deal with nutrition. We just have a huge, you know, area of coverage here that we deal with when it comes to nutrition. It's like mental health. Every aspect you deal with, you're going to deal with it. So also she helped to institute occupational and recreational therapy because, you know, when you're sick, a lot of times if you have chronic illnesses and stuff, okay, that can affect your ability to eat, drink, walk, talk. recreational therapy because you can become depressed, especially if you're in hospital for long periods of time. All right. And she also stressed the need for nurses to have continuing education. She also used the concept of apprenticeship in the hospital with the student nurses. And when you do your clinical hours, that's an example of that. So now the need for university-based education programs was brought to light during what important historical time?
A.
World War
Okay.
II.
World War II.
C.
Yeah, C, World War II. And this is slide number what, 16? So during the middle of the 20th century, Esther Lucille Brown wrote a report on nursing education. And she wrote that nursing education belonged in colleges and universities, not in hospitals. During the Spanish-American War, nursing was still in its earliest phase of development. Even with the input of Florence Nightingale and her followers after World War I, nursing still continued to struggle. But professional nursing began during the period and the crisis needs of World War II and continues to evolve today. So remember, World War II, women left the home, became more educated, and started to go out into the workforce. Other nursing pioneers, Clara Barton, okay, she was mainly responsible for the Red Cross or the development of it. Dorothea Dix, she was Fort Dix, I call her, okay. That helps me remember that she was instrumental in developing the Army Corps and leading them and establishing an Army Corps of Nurses. She also helped develop new treatments and standardized treatments for the mentally ill. Linda Richards, she was one of the first people responsible for us developing medical records and physician's orders. Linda Wald, her and Mary Brewster, they started a project up in New York called Brewster Street. And that's how public health began, public health nursing. And Lavinia Dock was instrumental in the right to vote. There's a few other pioneers, but these are mostly the ones that you will see questions about. All right, so who established the Red Cross in the United States in 1882?
Clara Barton.
Clara Barton, yes.
Clara Barton.
All right, she volunteered to care for those Union soldiers. She served as a supervisor of nurses for the Army of James, organized nurses and hospitals, and established the Red Cross in 1882. Clara Barton, Red Cross. Oh, what happened? It's playing. All right, can you see the screen?
Yes.
All right, in what time period did nursing care begin as we know it now?
19th century. World War II.
What time of food you missing?
Okay, from the middle of the 18th century to the 19th century. Social reforms changed. Come on. The role of nurses and women in general. It was during this time that nursing as we know it began based on the beliefs of Florence Nightingale. The registered nurse is performing a nutritional assessment to ensure that the client's diet is optimal for wound healing. The nurse's intervention can be traced back to which key contributor to nursing?
Florence Nightingale.
Good, Florence Nightingale. This nurse established the Nurse Corps of the United States Army.
Dorothy Dix.
Dorothea Dix.
Dorothea Dix, Fort Dix. Who established the first public health service for the sick and the poor?
William Ward.
Okay,
William
Lillian Wald and
Lillian.
Mary Brewster. Good. All right, so nutrition itself comes from the Latin word nutrix, meaning to nourish. The International Council of Nursing's definition of nursing means promotion of health, prevention of illness, and collaborative care. And then the American Nursing Association wrote its own social policy statement, okay, stating that the patient should be the central focus of all definitions, and that includes the physical, emotional, social, and spiritual components, because those are all included in the patient's healing and being able to function. The nursing's social policy statement describes the value and social responsibility of nursing and also provides a definition and scope of practice for nursing and nursing's knowledge base, as well as the methods by which nursing is regulated. Well, since I skipped to this one, you get to see the whole thing, the answer too. So which nursing group provides a definition and scope of practice for nursing? And that's the American Nursing Association, okay? It's a professional organization to advance and protect the profession of nursing, describes the values and the social responsibilities of nursing. It provides a definition and a scope of practice for nursing. It discusses the nurse's knowledge and describes the methods by which nursing is regulated within its nursing social policy statement. The American Nursing Association Standards of Nursing Practice defines the activities of nursing that are specific and unique to nursing. All right, Nurse Practice Act are laws established by whom to regulate the practice of nursing? Who establishes Nurse Practice Acts?
State.
Who?
The state.
The state, yes, each state. Good. So each state, okay, is designed to regulate the practice of nursing. The acts include the definition of important terms related to nursing, the definition of the legal scope of nursing practice, and establishment of educational criteria for each level of nursing. So it tells you exactly what the criteria is if you're going to be an RN, if you're going to be a PN, if you're going to be a CNA. So we have 4 broad aims of the nursing practice. They can be identified in the definitions of nursing: to promote health, to prevent illness, to restore health, to facilitate coping with disability or death. So to meet these aims, we use blended competencies of cognitive, which is about your knowledge, technical, which is about your skills, and this can be skills like doing wound care or running an infusion pump or running the computer, interfacing on the computer, interpersonal skills, which is how you interact and build trust with the patient, and ethical and legal. Most recently, these competencies have been investigated by the Quality Safety Education for Nurses, and they've come up with some project competencies, and those include patient-centered care, teamwork and collaboration, quality improvement, safety, evidence-based practice, and informatics. Are you guys all familiar with informatics? So what informatics is now, if you notice, like we have electronic health records, right? The physicians write prescriptions electronically now. The pad that the prescription is being written on by the physician interfaces with the computer in the pharmacy. So the physician doesn't even have to go to the pharmacy. He just puts it into that little pad and it interfaces. And that reduces medication errors. And also, if I have more than one doctor writing, it can help pick up like adverse events and stuff like that. So informatics was created to try to get the computer systems to merge. So this way, it actually started with the military, because they wanted to be able to go someplace like Iraq where they have their soldiers all there, and they want to keep their soldiers healthy because we need them in wartime. We need them to be healthy. So they would set up these medical units over in Iraq, and by using informatics, they're able to merge all of the patient's information into that one system. So they're able to see any vaccinations the patient got, any medical history, whatever pharmaceuticals that they're on, and all that stuff, so that they can provide the most up-to-date current care for these patients. So that was the whole point. And if you notice, they had this big initiative about 3 years ago through Medicare and Medicaid, where they wanted everybody to develop electronic health records. And all that came from the military. So these electronic health records help keep the patient's information in real time. So now patients even have their own portals where they can go in and they can log in and they can see everything about them and about their health. They offered incentives to different companies. Like if you were a doctor's office or whatever, Medicare and Medicaid offered incentives for you to create these electronic health records by way of giving extra bonuses to these physicians who incorporated this into their practice. And if they didn't incorporate it into their practice, then some of them lost money or were fined behind that, because they were given a directive. They had to do it within 3 or 4 years of the electronic health records being established. There are 4 blended competencies, okay? Professional nurses require cultivated attributes, the mastery of science, clinical experience, and we use all these blended competencies together to create this art or this form of nursing that we're going to be engaging in. So cognitive, these are those critical thinking skills, all right? This systematic way of thinking outside of the box, not just assuming that when someone falls, it's their blood sugar or their blood pressure or they're having a heart attack. You really have to put all the pieces together and do some investigation, become, this investigative reporter, try to find things that correlate, that go together, patterns, and experience is going to help you create this way of thinking, so that you don't automatically just assume one way of thinking, because when you do that, you might miss something with the patient and mistreat them. So your job is to always provide the best care that you can and do more good than harm. Technical competencies include working with your hands, so things like wound care dressing, doing things like putting in straight caths, doing technological work, like you're going to run a PT-INR machine, you're going to run the glucometer, you're going to run the infusion pump, oxygen machines, oxygen concentrators, and you're going to run a lot of different technical equipment. So it's not just your hands-on skill, but also whatever else you have to run. And also that includes computers. Interpersonal skills, these are the way that you incorporate your care towards your person-centered practice, or catering that care towards the patient, which involves promoting dignity and respect. So in order to do that, you have to provide an environment that says that I care about you. You have to provide an environment that's culturally competent. I understand about your culture. I understand it's not like mine, and I'm here to support you in the things that you're going through. And I want to learn about you and your culture so I can provide you the best care as possible. And then also involving the client, like in everything about their plan of care. So you're not just making decisions for them, you're incorporating them in that plan of care. And then nurses who want want to be sensitive and ethical to legal implications of the nursing practice. So, you know, doing things like not signing for your meds when you give them or pre-signing for your meds. Okay. Doing things like not documenting right away and waiting till the end of the shift to document. And then a 911 happens and you forget and you don't go back and document and something happens to that patient. Something detrimental happens to that patient as a result of you not documenting. Legally, you're responsible for that. Also, when you write notes and documentation on patients, what you have to remember is if that patient, something were to happen to them and they were to come back at you or the facility, it's not going to happen tomorrow. It's going to happen 5 years from now or 10 years from now. So if there was nothing significant about that patient that really sucks your memory, you're going to, you know, assume or have to go back on your memory about what took place with the patient unless you have clear, legible handwriting documented in the chart somewhere about what you did with that patient, because you're not going to be able to go back and, you know, sometimes I write a note and I go back like the next day to read it and I go, what did I write there? Did you ever do that? You're in a hurry and you write a note and it's really not that legible.
Definitely.
And you go back the next day and you try to read it and you're like, you're struggling to read it. Or a week later and you're struggling to read it. Like, what did I write there? So imagine what it's going to be like 10 years from now or 5 years from now when you have to go to court for that patient. You want to be able to read that note. The QSEN competencies, okay, these talk about client-centered care, teamwork, collaboration, quality improvement, safety, evidence-based practice, and informatics. All right, so teamwork and collaboration. This includes allowing the client to participate and be in part of the care and part of the decision-making process, as well as all the other providers. So you have a team of providers. Maybe you have somebody there from PT, somebody from speech, somebody from cardiology, okay? And then you have the patient in there. And this is going to help foster communication, provide mutual respect. It's going to allow for shared decision-making. The team can discuss, you know, the decisions all together at once instead of, oh, well, we'll talk about this now. And now we got to go call Dr. John because he wasn't here. And Dr. John will call us back, you know, 2 hours from now and let us know what he thinks. And then Dr. Greg, well, he's going to call us back too. So, you know, if you could have everybody there at the bedside with the patient, it really could foster for better care. Safety measures, okay? What shows competency and safety? So their example here is using the side rails on the bed, all right, of a confused patient. So if you're using the side rails in a manner that shows safety, yes, but you can't use those same side rails to keep a patient in bed, right? Because it's considered a restraint if you do it in the wrong manner. So you have to determine, should I put those side rails up on a patient that's confused? Because it could create two dilemmas for me. One of them being that someone could perceive it as a restraint. And the other dilemma is, if my patient's confused, is that side rail going to keep him in the bed? Will it?
No.
What
No,
happened?
they'll try to climb over it.
Right. And then they end up falling, right?
Yeah.
Yep.
So that means whoever put that side rail up really isn't competent in safety. They need in-servicing or training. A new technique for patient care based on the latest research is an example of evidence-based practice. So an example of this is using the stethoscope for auscultation. All right, for when you're checking placement on an NG tube or a G tube. How many people are still being shown that method? Anybody? Hopefully everywhere you work has phased that out. Okay, because it's not a way to check placement. All it does is tell you I can hear air there somewhere. We have to do x-ray. That's the only way to really confirm that any tube has been placed. And actually the Hospital of Cincinnati did a study on children on the pediatric unit, and 70% of the NG tubes placed using auscultation were placed in the wrong area and resulted in some sort of injury to the child, either through the way of pneumonia, aspiration pneumonia, or peritonitis or something like that, because it was in the wrong area. So we don't use that anymore. But, you know, if you go to some old school nurses, they're still doing that. All right. So they won't want to hear from you, this new young hotshot nurse, that, hey, this isn't the proper way to do this now. We have to measure the G tube to see where it exits the body to where it ends. And we monitor that measurement to make sure it doesn't migrate. We have to monitor the patient for signs of intolerance of the feed. How much residual are they retaining? Do they have any nausea, any vomiting, any abdominal distension? So those are the things that we have to look at for this patient. Gaining input from a client about personal goals for rehab. So what is the client's goal, right? Because no matter what your goal is, if it doesn't meet their goal, it's just a waste of time. Because you can't get someone to agree to your goal. They have to agree to their goal. Your goal might be for them to walk 100 feet, and their goal might be to walk 5 feet. So, you know, if their goal is to walk 5 feet and your goal is to walk 100, you're not going to have anything but a problem with that patient. So you either have to ask the patient what their goals are, or try to find a way to get the patient, you know, to buy in to what's going to help them. That's going to help them comply. So again, those QSEN competencies are patient-centered care, teamwork and collaboration, quality improvement, safety, evidence-based practice, and informatics. So the competencies help support responsibilities that were previously defined on when I was talking on the other slides. It helps provide focused care for the client. Okay, it allows the nurse to be able to balance out advocating for the client versus safety. It allows the nurse to manage and coordinate care. And it also is going to require that you work in teamwork and collaboration, which teamwork is always best anyway. As the RN, you know, you want to lead by example. So when you do things together on the floor with the other nurses, you're going to get a better response and a better action and reaction from them. Competence in informatics allows you to be able to use the latest technology in documentation and evaluating care, and nurses that are able to achieve these competencies are able to improve the quality of safety and care of clients where they work. And so, you know, when you get to the end of this course, one of the things that you're going to have to do before you graduate is a mock interview. And when you do a mock interview, you're going to have to write a statement on your resume. And that statement on your resume, you're going to want to show your employer what ways are you going to help improve either their missionary statement or the quality of care for the patients that you're going to be caring for. How do your goals head towards that direction, towards that patient-centered care? So the Quality and Safety Education for Nurses initiative has been identified for which key competencies for nurses? Who's taking notes?
Patient-centered care.
All right, so client-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. These are the key competencies for quality safety education for nurses. Health itself is a state of optimal functioning according to the World Health Organization, and it includes physical, social, and mental components. It's not just the absence of the disease or the infirmity. It's often a subjective state. So people that are chronically ill might even consider themselves to be healthy still, because it's how they identify themselves. We promote health by identifying, analyzing, and maximizing the patient's individual strength, preventing illness, helping restore health to the previous level of function. We facilitate coping with disability and or death. So the focus in the definitions of nursing is the patient, all right? The patient receiving care. Again, that includes physical, emotional, social, and spiritual dimensions. Also, nursing definitions have expanded, and these include preventing health, promoting and maintaining health for not just people, but families, groups, and communities. There's 4 broad aims of the nursing practice, all right? Promote health, prevent illness, restore health, facilitate coping with disability or death. When we promote health, okay, we try to maximize the patient's strength, prevent illness, restore health, and help them facilitate or cope with disability or death. We also want to encourage our patients, be proactive, take measures to foster their well-being and help them to maximize their optimal functioning, their independent functioning. Some factors can affect the patient's health, okay? Genetic inheritance, cognitive abilities, educational level, race and ethnicity, culture, age, gender, developmental levels, lifestyle environments, and socioeconomic status. Healthy People 2020, these are the health promotion guidelines. So their idea is that people should have high quality, disease-free, disability, injury-free lives and prevent things like premature death that are totally preventable. We want to achieve health equity. So what does this mean? Eliminate disparities and improve the health of all groups. So if you go certain neighborhoods, right, you still don't see doctors' offices or hospitals in those neighborhoods. Still certain people don't have easily access to certain types of healthcare, or they don't have healthcare to the same types of doctors because of their either financial or insurance status. Okay, so we want to try to eliminate those disparities, and instead of having liquor stores on every corner of those neighborhoods, having doctors' offices and access to the same health care that everybody else has. Patient-centered health promotion is a framework for nursing activities. The nurse has to consider the patient's self-awareness, health awareness, and use of resources by providing care. So for preventing illness, okay, the objectives are to reduce the risk for illness, promote good health habits, maintain optimal functioning. So we're going to use programs like prenatal care for pregnant women, smoking cessation, stress reduction. We might have community programs or resources that help encourage healthy lifestyles. And then we may do literature, commercials, TV promos, or internet information on how to maintain a healthy diet, exercise, and other good habits. And then we might conduct things like health assessments in clinics or on those buses that come around the community, okay, or maybe even in an institution, looking at the different areas of strength and risks for illnesses in that particular community. We always want to restore our patients' level of health back to their previous level of functioning. So that is our job when they come in the hospital, is try to get them back to that, or as close to that as we can. That's going to help maintain their independence, and it's going to help them overall. So this has traditionally been the nurse's responsibility. Okay, and it focuses on the person with the illness and arranged from early detection to disease rehabilitation and teaching during recovery. So we do things like we perform assessments. We refer questions or abnormal findings to the physician or other specialists. We collaborate with other providers. We provide direct care to the person that's sick. We plan, we teach, we carry out rehab. All right. And we work for patients when they have a heart attack or arthritis or a stroke. We work with them and we try to get them back to however they were before they had that heart attack, before they had that stroke, before they had that arthritis. And all that is to help maintain their independence. Okay. And then we work with the mental health population and with those that are chemically addicted. To help patients cope with disability and death. So we want to maximize their strengths. What are their strengths and weaknesses? You know, take a look at the patient, try to figure that out, and try to feed to those strengths and weaknesses. What kind of resources or supports can you ask them to, can you give to them or provide to them to help them, you know, access those types of supports? Sometimes people don't know what direction, where to turn, or who to go to, or what number to dial. You might be providing end of life care, or you might be referring them even to a hospice program. So first, our major goal is to promote, maintain, and restore health, but we can't always do that. So when we can't do that, then we help the patient and the family cope with the altered level of functioning, with the current life crisis that's occurring, okay, or with death, if that's what the issue is. And then that altered level of function is going to decrease that person's ability to carry out their everyday activities of daily living, and that is going to alter their role function. So meaning that if, let's say, my husband was suddenly diagnosed with congestive heart failure, okay, if he's the main breadwinner in the house and now he has this congestive heart failure and he can't be the breadwinner in the house, you know, psychosocially, how's that going to affect him? Anybody?
Depression.
Depression.
Okay, because depression, it could also create anxiety. It could create jealousy, right? Because if another man now helps that woman in some kind of way, even though he might not mean anything totally by it, like it could be just a good Christian faith, he may feel some kind of way that some other man is doing something for his family or for his wife that he's not able to do. So it really can make a lot of psychosocial, you know, effects on someone. So these are things that you have to think about. It's not just that they lost their leg, or it's not just that they had a heart attack. And yes, maybe physically they're going to be fine. And oh yeah, you shouldn't worry. At least you can live. At least you lived. Other people died. But is it really living? And that's what you have to think about. Because for some people, if they were to lose a finger, that would be a very traumatic thing for them. Because in some cultures, losing a body part is considered really detrimental, or really, you know, it really puts a big psychosocial issue for that patient because they're missing that body part. Any of you come from a culture like that?
No.
I mean, some of you may be familiar with some of the cultures overseas, like in some of the Asian cultures, okay? If someone steals, what do? They chop off the hand. Why? Because that hand represents a certain value. And also, as soon as that person walks in a store and they see the person missing a hand, they automatically think what?
You think
They're a thief. How about if somebody comes in a store that was born without a hand? How would they know the difference? How would they be able to determine who was physically disabled and who was a thief?
they wouldn't?
Exactly. So a lot of cultural components, you know, the way things play out, you have to be really cognitive of the different cultural things that can happen from one, you know, ethnical group to another. And sometimes we have no idea because we just don't listen or we just don't see. All right, so we also can help people achieve that optimal level of functioning. All right, we can encourage them, we can teach them, we can help them maximize certain components of the healing process by recognizing their strengths and feeding into those and helping them work through their weaknesses. We can also refer them to community support systems. We can provide care to the patient and the family. We can do it for end of life, for chronic illnesses, for acute illnesses. We can do it in a hospital. We can do it in a long-term care facility or in the home. We also may have to help some people prepare for death, okay? Because we know that death is going to happen and sometimes it's not avoidable, no matter how much we want it to be. Healthy People 2020 establishes health promotion guidelines for the nation as a whole. And the guidelines contain leading health indicators, which are used to measure the health of the nation over a 10-year period. So sometimes you might see questions about this. They do like to ask a lot about the different questions. So with Health Promotion 2020, this is like national guidelines that they put out that they recommend that certain people in the nation do this, that, or the other thing. So whenever I see something for our Healthy People 2020, I try to pay close attention to it because it is an area that I frequently see them asking questions on. Come on, computer, work right. All right, so what is the primary aim of Healthy People 2020? What is their initiative?
To inform people.
Health promotion.
I guess I didn't put that slide there. We'll go backwards. So, okay. They use these health indicators for health promotion, all right, to measure the health of the nation over a 10-year period to see how healthy they are or if certain disease are becoming more prevalent or if there's certain things that are happening that weren't happening, 10 years ago that are now happening. Well, one of those things they're going to see now is what?
Coronavirus.
Yeah, coronavirus and the effects. And it's going to be a big mystery for people with a lot of stuff because there's so much involved in coronavirus. Like they don't really know the incubation period. They don't really know how long it stays in your bloodstream. They don't really know what all body fluids that it's carried in. They have a pretty good assumption. Okay. They don't know what all damage that it does to the heart yet. And different people seem to be affected differently by it. And also, we see it now affecting a different population than what it was affecting 6 months ago or 3 months ago. The nurse is caring for a client after a stroke render the client's right side weaker than the left. The nurse coordinates the plan of care with the physical therapist. The nurse's interventions reflect which one of the nursing's 4 broad goals.
Restoring
Health.
Facilitate coping.
A.
to restore health.
A,
Okay, to restore health. Good. When administering immunizations, the nurse is engaged in health promotion, illness prevention, health restoration, or coping facilitation.
A.
Prevention.
C.
B.
C.
Okay, it's B, illness
Illness.
prevention. Illness prevention activities reduce
Oh,
the risk for illness.
immunization.
Yes.
Okay, administering immunization.
All right, so we have these interrelated roles, okay? We work together, we're everything, right? We wear all these hats. We're the communicator, we're the teacher, we're the counselor, we do research, we advocate for the patients, and we collaborate care. We do all these things every day as a nurse. You probably do some of this stuff too as a PN, all right? Even though, you know, they tell you that you're not supposed to do assessment, you're not supposed to do teaching, but I know you guys are out there doing some of this stuff. Nursing itself as a professional discipline is considered that because there's a well-defined body of specific and unique knowledge that you have to be a nurse. It's a strong service orientation. It's recognized by authorities as a professional group. There's a code of ethics. We have a professional organization that sets standards that we are required to follow. And we have ongoing research. Also, it's very autonomous and self-regulated. So the smarter you are, the more critical care thinking you're able to do, the more your physician trusts you, the more autonomy you're going to have. Nurses use existing and new knowledge to solve problems creatively, meet human needs, and were recognized as a profession based on the criteria that I just gave you. Practical and vocational nursing education helps establish certain criteria. It teaches graduates how to provide care at the bedside. Then we have registered nursing education. Those can be achieved through a diploma, an associate's degree, or a bachelorette. We have graduate education in nursing, and then we have continuing education and in-service education. What was the first international organization of professional women? Come on.
ICM.
Is it the ANA and
International Nursing Organization. Okay. So we use some specific guidelines for nursing, the standards of nursing practice, nurse practice acts and licensure, and the nursing process. Nurse practice acts help define the legal scope of practice. They create state nursing rules and regulations for each state. They define terms and activities, including legal requirements for both the RN and LPN. Okay, and they help establish the criteria for education and licensure. The nursing process is used. Okay, you guys should be familiar with that, right? That's your ADPI. You'll be using that. We'll be talking about that. We'll be using it for your nursing care plan, okay, and throughout this course. It's a guideline for the nursing practice. It helps you implement your role. It helps integrate art and science. It helps you use critical thinking and reasoning, and helps define the areas of care that are within the domain of nursing itself. So the National League of Nursing says there are 10 trends that you should watch for in nursing education. So right now we see a change happening with demographics, and we see an increased amount of diversity. The technological explosion. So we talked about that with the nursing informatics, the computer use, you know, the use of all the new technical pumps and all that stuff. Globalization of the world's economy and society. The era of educated consumer and alternative therapies and palliative care. All right, and genomes, which is, you know, studying genetics and about people. The shift of population-based care and increasing complexity that we have now with patient care. So patients got to be really sick now to be in the hospital. So when they're in there, their care is fairly complex. The cost associated with the health care and challenges about managing it. And then the impact of health policy and regulation. Also, the need for interdisciplinary education and collaborating. We do have a current nursing shortage. Even though they keep saying that, I still hear about nurses getting laid off. Okay, opportunities for lifelong learning and workforce development. So right now, the kind of nurses that you see getting laid off, a lot of educational type nurses, and nurses that do different types of specialties. All right, significant advances in nursing science and research. An organization open to all people interested in nursing, including nurses, non-nurses, and facilities is what? It was established in 1952 to foster, develop, and improve all nursing services and education.
Is it AMA?
The National League for Nurses.
National League for Nurses, good. The nursing itself controls and guarantees its practice through what?
Standard.
The 88.
Standards of practice, Nurse Practice Acts, licensure, the ANA's Code of Ethics, professional values, and use of the nursing process. So each of these are going to guide your nursing education as a student and how you practice once you actually graduate. The ANA 2015 nursing statement says that scope and standards of practice helps define activities that are specific and unique to nursing practice. The standards allow nurses to be able to carry out professional roles, serve as a protector for the patient, for the institution where the care is provided. Each nurse is accountable for their own quality of care, and you're responsible for using standards, ensuring that you have the proper knowledge, that you're safe, and that you are comprehending the nursing care. So you can't just have the knowledge to do it. You have to have comprehended it and really understand how to do it. And if you don't, then you have an obligation to ask somebody. Standards of practice help address key steps that we should be using as a nurse to care for patients. The standards of professional performance address key concepts that the nurse would integrate into their role as a professional nurse. Laws established in each state in the United States to regulate the practice of nursing are called what?
Nurse Practice Acts.
Nurse Practice Acts. They are broadly worded and vary among states, but all of them have certain elements in common. Professional values provide the foundation for nursing, and they'll help guide your interaction with the patient, with other colleagues, and the public. So we always say you have to have pride, you have to act professional. The American Association of Critical Nurses identified 5 values that epitomize caring professional nurse. So those are altruism, autonomy, human dignity, integrity, and social justice. These values are specified in the American Nursing Association Code of Ethics for Nurses. Essential activities involved in the nursing process are
The ADPI.
the ADPI: assessing, diagnosing, planning, implementing, and evaluating. These are essential activities involved in the nursing process. All right, we talked about Florence Nightingale a little bit. She took the status up for nursing to a respected occupation. She improved the quality of care and founded what we now call modern nursing education. The ANA defines nursing as protecting, promoting, optimizing health and abilities, preventing illness and injury, alleviating suffering through diagnosis and treatment of the human response, and advocacy of the care of individuals, families, communities, and populations. So when we talk about Sister Calista Roy, she kind of talks about this a little bit. I don't know how many of you went through the PowerPoint for Sister Calista Roy, but she talks about the human response. How's that behavior response? How does that person adapt to the illness or to the changes that are currently going on in their life? Those 4 broad aims, remember, they are promoting health, preventing illness, restoring health, and facilitating coping with disability or death. Remember, you have to use cognitive, technical, interpersonal, and ethical legal skills to do this. And then the quality and safety education for nursing says we need these competencies: patient-centered care, teamwork, collaboration, quality improvement, safety, evidence-based practice, and informatics. As you know, different programs can get you different licensing. We talked about this a little bit a couple of slides ago. So depending on how far you want to go with it. Graduate programs include master's degrees, Doctor of Nursing and Doctor of Nursing Science. PhDs, we already talked about the diploma nurse, the associate nurse, and the bachelorette nurse. Remember that nursing controls and guarantees its practice through standards of practice, the Nurse Practice Act, licensure, and using the nursing process. Critical challenges to the nursing practice in the 21st century include a growing population of hospitalized patients. And what are they doing? They're getting older, right? Because we have this better, more advanced care. So people are living to be older, but they have these, chronic illnesses and stuff that we have to treat. There's going to be an increase in healthcare costs associated with that. And they're going to need advancement in healthcare so that we can stay current with what's going on with these patients. The nurse is caring for a patient with a possible cerebral aneurysm in the ER. The nurse anticipates preparing the patient for ordered diagnostic tests. What aspect of the nursing process does this nurse's what aspect of nursing does this nurse's knowledge of the diagnostic procedure reflect? Might help if I could read tonight.
Part of nursing.
B.
B.
Okay, B. the diagnostic portion. Let's see, what slide is this? I just wanted to elaborate on this a little bit more for you. So I was looking for the slide. Okay, the science of nursing is the knowledge base for care that is provided. In contrast, the skilled application of that knowledge is the art of nursing. Providing holistic care to patients based on the science of nursing is considered the art of nursing. Nurses today complete a nursing education program and to practice nursing that identifies the personal needs of the patient and the role of the nurse in meeting those needs. Which nursing pioneer is most instrumental in this birth of modern nursing?
Florence Nightingale.
Yes, Florence Nightingale. Florence Nightingale elevated the status of nursing to a respected occupation, improved the quality of nursing care, and founded modern nursing education. Clara Barton established the Red Cross in the United States in 1982. Lillian Wald was the founder of public health, and Lavinia Dock was instrumental in establishing women's rights to vote. The role of nurses in today's society was influenced by the nurse's role in early civilization. Which statement best portrays this role?
D.
Second.
Okay, the nurse was the mother who cared for her family during sickness using herbal remedies. In early civilizations, the nurse usually was the mother who cared for the family during sickness by providing physical care and herbal remedies. This nurturing and caring role of the nurse has continued to today. At the beginning of the 16th century, the shortage of nurses led to recruitment of women who had committed crimes to provide nursing care instead of going to jail. In the early Christian period, women called deaconesses made the first organized visits to sick people, and members of the male religious orders gave nursing care and buried the dead. The influences of Florence Nightingale were apparent from the middle of the 19th century to the 20th century. One of her accomplishments was identifying personal needs of the patient and the nurse's role in meeting those needs. Nurses today work in a wide variety of healthcare settings. What trend occurred during World War II that had a tremendous effect on the development of the nursing profession?
A.
A.
Okay, A, there was a shortage of nurses and an increase on emphasis on education. So during World War II, a large number of women worked outside the home. They became more independent and assertive. That led to an increased emphasis on education. The war created a need for more nurses and resulted in that knowledge explosion in medicine and technology. The trend broadened the role of nurses to include practicing in a wide variety of healthcare settings. A nurse practicing in primary care center uses the ANA's nurses social policy statement as guidance for practice. Which purposes of nursing are outlined in this document. Select all that apply.
B, C,
F, E, C,
C and D.
B, C,
B,
D,
C, and D.
Okay, C, D, and E. The
Oh.
ANA social policy statement describes the social context of nursing, a definition of nursing, the knowledge base for nursing practice, the scope of nursing practice, standards of professional nursing practice, and regulation of the nursing practice. The provision of standards for nursing educational programs is usually falling under the State Act. State Practice Act. Remember, State Practice Act defines the educational criteria for the PN or the LPN. A nurse working in a rehab facility focuses on the goal of restoring health for patients. Which examples of nursing intervention reflect this goal?
A, B, and C.
Okay, good. A, B, and C. The nurse counsels adolescents in a drug rehab. Nurse performs range of motion. Nurse shows a diabetic patient how to inject insulin. Activities to restore health focus on the person with an illness and a range from early detection of disease to rehab and teaching during recovery. Activities include drug counseling, teaching patients how to administer medications, and performing range of motion exercises for bedridden patients. Recommending a yoga class for stress reduction is a goal of preventing illness, and teaching a nutrition class is a goal of promoting health. A hospice care nurse helps facilitate coping with disability and death. A nurse instructor outlines the criteria establishing nursing as a profession. What teaching point correctly describes this criteria?
C, E, and F. A, E, and F.
Okay, C, E, and F. Nursing is recognized increasingly as a profession based on the following criteria. It has a well-defined body of specific and unique knowledge. It is a strong service-oriented profession. It is recognized by authorities as a professional group. It has a code of ethics. It's a professional organization that sets standards. It provides ongoing research and autonomy and self-regulation. A nurse is practicing as a midwife in a busy OB/GYN office. Which degree in nursing is necessary to practice at this level?
MSN.
MSN.
MSN, a master's degree. A master's degree prepares advanced practice nurses. Many master's graduates gain national certification in their specialty area, for example, family nurse practitioners or midwives. Nursing in the United States is regulated by the State Nurse Practice Act. What is a common element of each state's Nurse Practice Act?
A.
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 Okay, A. Nurse Practice Acts are established in each state to regulate the practice of nursing by defining the legal scope of nursing practice, creating a state board of nursing to make and enforce rules and establish and regulations, define important terms and activities in nursing, and establish criteria for the education and licensure of nurses. The acts do not determine the content covered on the NCLEX, but they do have legal authority to allow graduates of approved schools of nursing to take the licensing exam. The acts may also determine educational requirements for licensure, but do not provide the education. Institutional policies are created by the institution themselves. All right, we got about 10 minutes. So do you guys want me to start too? Or do you want me to give you the code and we can work on it on Friday?
Give us the code.
You know, because I know people are thinking turkey right now. And I would like
Wait,
you
Miss
guys
Lo,
to.
Professor Loach, what's on Friday?
So Friday from 9:30 to 12:30 will be your tutoring session. Now for tutoring sessions, guys, all you have to do is click on the link just like you're coming into class.
Okay.
But I also sent you guys a Zoom link, which should always
9:30
work.
a.m.
9:30 a.m. to noon.
So will there be another opportunity for you to go over the next chapter? Because
Yep, I'll be going over the other chapters and we'll try to get to some questions. If anybody has questions about the math quiz, I'll actually be able to pull up the math quiz at that point because it'll be locked so nobody can go back in there, you know, to do the math. So at that point, I can actually show you guys the answers and the questions. Let's see, where is the live interaction code? What do I do with it?
Yeah, will you still go over the next chapter in the next class?
I'm sorry. No, not in the next class. Probably not, because we'll be moving on. Because every week we have new chapters, new chapters, new chapters. But if I get the chapters recorded, right now I have most of one recorded, not all of it. So I still have to record 2, 3, and 4 to get them up. That way, if you guys want to look at the recordings, I don't have those ones done yet.
so next week we're moving to chapter 3, is what you're saying?
Yeah, next week we'll be moving actually to 5, 6, and 7 because your lecture next week is going to be on 5, 6, and 7. Right? That's what's your lecture should be on next week, I believe.
Yeah, that's correct. Going off of the syllabus. Yeah, the next time we meet up, it'll be 5, 6, 7.
What I will do is I will send you guys the PowerPoints that I do have broken down. So at least you'll have those to study with. And if I can find the live code, I'm going to give it to you. What the heck is it?
Next, our next class, we also have a dosage calculation test as well.
Okay, so you want to make sure that you do that. You have to do all dosage calculation practices, all dosage calculation tests. Now the test you have to get 80% or higher on. Okay, so you have to get 80% or higher on at least one dosage calculation test.
So on Friday, where you said where are we meeting? I mean, I don't know the specific area.
You go to the same Zoom link that you go in when you come for a live interaction like tonight.
Oh, okay. Okay.
What about if the test was not giving you the credit because you didn't put ML?
So anybody who took a test already, if you took it prior to like 2 o'clock this afternoon, I already graded it.
Okay.
I already went in and hand graded them. So if you still have wrong answers and you taken both attempts, then you can meet me one-on-one and I'll go through and show you where your mistakes are.
Now, I only did one attempt because the first one, I guess I accidentally clicked on it. I never answered none of the questions. It just, the time lapsed. So it didn't give me no credit for it. And then I went back.
I got an email from you and I went back and did it. And that was, it counted as 2 versus I only did it once.
Right, so because you opened it, you automatically lost that attempt. So